In our first video here, we see the muscle fibers of the semimembranosus and semitendinosus with visible trigger point locations in the middle of the bellies. The referral for both of these muscles will be a shared referral where you see in the orange at the ischial tuberosity with minor spill into the posterior thigh right in the septum between the medial and the lateral hamstrings. Next, we have the lateral hamstrings, the long and short head of the biceps femoris. Here, the pain referral locations are going to be, again, in the belly of the muscle, but slightly more distal towards the knee. The referral location is going to be in the popliteal fossa in the back of the knee, with spillover proximal into the middle portion of the posterior thigh. Here we have glute max with trigger point locations along the attachments on the sacrum and coccyx, as well as one close to the insertion on the gluteal tuberosity and iliotibial band. The location of these referrals are going to be along the proximal and superior end of the sacrum and iliac crest, with spillover along the sacrotuberous ligament, which is right where the sacral edge is, into the top of the ischium, as well as some referrals towards the outside of the hip close to the iliac crest. Here we have glute minimus, deep inside the lateral hip with trigger point referrals both at the proximal and distal attachments of the muscle belly right above the greater trochanter. The pain referrals for this muscle are going to be around the hip itself with very long referrals down the posterior thigh and leg, as well as the lateral leg, mimicking sciatic pain, giving this muscle the nickname pseudo-sciatica. Here we have glute medius with trigger points located along its proximal attachment at the iliac crest. We'll see, unlike a glute minimus, that there are no trigger points along the attachment at the greater trochanter. Here we see the pain referrals for glute medius. The first is going to be along the posterior iliac crest sacrum with slight spillover towards the greater trochanter. We'll also notice that this pain referral does emerge up into the lower back around L3, 4, and 5. So this pain referral could be described as low back pain. One of the most important referrals for this muscle is right along the sacral base itself. This pain referral seems to cover the whole sacrum and will be described again as low back pain. Lastly, we see some pain referrals deep into the posterior iliac space along the inferior iliac crest with some spillover towards the hip joint itself. Here we have our deep 6 lateral hip rotators with trigger points located in the belly of piriformis, as well as throughout the obturator, gemellus, and quadratus femoris muscle bellies. The location of these referrals are going to be primarily around the sacroiliac joint and the attachments at the greater trochanter with slight spillover into the proximal posterior thigh. The most important thing to keep in mind is the passage of the sciatic nerve through the sacral notch with the potential of piriformis to press and entrap that nerve, creating sciatic-like pain. While that is not a pain created from the trigger points, it is a pain that is caused by this tissue, so worth mentioning at this juncture.